Hello, this is a report of the Healthy Community Brookfield. It's presented by me, Abby Graham, the Executive Director for the HCB Board of Directors. So the presentation goals and objectives. One of the objectives is to provide a brief overview of HCB's programs and services, to explain the current mission and vision of HCB, an overview of the environmental factors, situation analysis of HCB strengths, weaknesses, opportunities, and threats, present a new revised mission and vision, a 5-year strategic development plan with an action plan, identify barrier solutions, resources, and stakeholder involvement, and describe the evaluation process of the strategic plan. So, an overview of services offered. As you are aware, we're a nonprofit organization aimed to improve the health of the Brookfield population. We were created in 1998 from a large donation to promote public health awareness. We are formerly a division of the local county health department. We are part of a visiting nurse agency called Brookfield Community. They aimed to improve cardiovascular health among the population. We currently provide public health care services, educational programs, and other related services, some of which are state mandated. Here's a list of our services offered. You can quickly browse through them. They range from elder care services to community outreach programs, educational programs, violence prevention, well water testing, so really provide a whole array of services. Our mission and vision. Our current mission is, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. Our vision is, as a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. So, our environmental factors. We have been described as a ship without a navigation system, rudder, or sail. So basically that means that we have some public opinion, that's through the community, staff, and stakeholders, that are not clear about who we are and our services and mission. Staff is mostly satisfied with us, yet funding insufficiencies have created a source of worry, and there has been high turnover rate. Key stakeholders such as physicians, police, farmers, they question the mission of HCB and don't agree with all the programs offered. There are some duplicate programs, such as the local hospital provides a diabetes program, and some of the farmers really don't agree with our well water testing programs. We have funding insufficiencies. We have cut recently some programs, and it's possible we may cut more in the future. We are, as you are aware, mostly grant funded, and we have some funds generated through the local county health department. Our relationship right now with the local county health department is a little bit strained due to yearly funding request increase and our failure to meet the FAB, Public Health Accreditation Board, standards. So this is a SWOT analysis. We have strengths, weaknesses, opportunities, and threats. Most of them I briefly touched on in the last couple slides, but I'll just go over a few. So our strengths really are that we have knowledgeable staff, we're rooted in the public, we provide some great services. We have some weaknesses such as the high staff turnover, funding insufficiencies and program cuts, kind of a lack of clear mission and value within the organization, and some stakeholder disagreement. We have opportunities to provide a community health assessment, or the CHA. We also can offer some more local programs, ones that are in need, services that are in need. We can strengthen our vision and mission to clarify the stakeholders, become FAB accredited, create a strategic program, and some of our threats. We didn't meet the FAB accreditation. Certain programs may be cut, financial problems. So this SWOT analysis, you can look how the strengths, weaknesses, opportunities, threats all interplay. So, for example, we can use our strengths and opportunities to offset our weaknesses and threats, and vice versa. The revised mission and vision. So we made this more concise and really, cut down on the wordiness and really to show what we're aiming to do and doing here. So revised mission is to improve the health of Brookfield community by delivering essential public health services. And our vision is to striving to make Brookfield the healthiest community in America. Our 5-year strategic plan strategies. So within the next 5 years, we need to meet FAB accreditation standards to strengthen our relationship with the county health department and increase funding. We need to strengthen and figure out our mission, vision, and goals. We need to create a strategic financial plan and create a community health outreach program and assessment to determine the needs of the population. We need to better engage stakeholders to determine what services are currently provided and to listen to their concerns. So our action plan. We need to meet FAB's Domain 9 standards within the next 6 months. This will be done by creating a comprehensive quality improvement plan. It'll be completed by the executive director along with the staff. The resources are staff time and for planning and adherence to this quality improvement plan. We next will determine the mission, vision, and goals of the program, most important to HCB, within the next 3 months. So this is to be completed by the directors and executive directors. The resources this needs is time, and we need to update all of our printed and virtual material of our former mission and goals. This may cost some money to update any of the prints and websites. We also have a 3-year-long CHA, the Community Health Program. That will be in collaboration with the local health department. This is to determine the needs of the population and spread awareness. This will be completed by the community health team. The resources are capital for the whole program, the paperwork, surveys, mailing expenses, data compilation. But luckily, we will be partnering with the county health department to share resources and the data for this program. The board of directors will meet with stakeholders quarterly over the next 5 years to determine input and concerns regarding programs and services. This is important to figure out what, meet the changing needs of stakeholders and the programs that they're offering, such as law enforcement, medical facilities, everything that they're offering. Resources. This will need financial resources to hold the conferences 4 times a year for the stakeholders, and depending on what programs are deemed necessary on our end, they may cost different amounts. The 5-year financial plan will be provided by the Chief Financial Officer to achieve financial stability. This has to be started right away. This, along with the CHA and stakeholder input, will determine what services and how many services we can provide to the public. The resources are time for grant writing, applications, but this may possibly generate more funds. Evaluation of the plan. So the plan will be evaluated in a survey to the community through the CHA, the health assessment, as well as stakeholder feedback at these quarterly meetings. So we'll ask them how we're doing, give us feedback. Do they understand what we're doing? Are the programs beneficial? As well as if we form new organizational relationships and partnerships, as well as get grants and local county health department funding increases. That would tell us if we're doing a good job, as well as if we are meeting the FAB accreditation requirements. So barriers and solutions to action plan items. One barrier is if stakeholders are disagreeing on programs. So whether that's us prioritizing what program to put out, or if one stakeholder thinks this program should take place and another doesn't. So we would mitigate this by having communication with the stakeholders, us communicating with them, mediating when necessary, them communicating with each other, and encouraging them to engage in, if necessary, creating a rotational schedule for some of the high demand programs. And another barrier is a loss of grants from the new missions and goals. So if we are no longer just applying for every grant we can, even if it doesn't match what we want or our mission, we may lose some funding, but in the long term, it should result in more funding with our strategic financial plan, because funders and investors can feel confident investing in a community organization with a financial plan. Another barrier is if we have lack of community engagement in the job. So we could provide some incentives if necessary, fundraising, prizes, and explain the benefits for individuals for participating in community engagement. So what they will get out of the services and programs if they engage. So in summary, we provided the SWOT analysis. We have a new, simpler mission and vision, a 5-year strategic plan with action items. We've identified barriers and mitigated these barriers and how to evaluate our success. So in all, the goal of the strategic plan is to strengthen the community, stakeholder relations, improve the programs offered by Healthy Community Brookfield, and create a long-term financial stability. Thank you.